Elizabeth I was England's most powerful queen, famous for the Elizabethan Golden Age and maintaining stability after decades of chaos under her father, Henry VIII, and siblings. She died at age 69, extremely old for her era, which made infections far more dangerous. Her face was swollen on one side. She had a sore throat. She didn't respond to people and just stared at the ground. Tudor England had poor hygiene and no concept of sterilization. Elizabeth suffered from rotten teeth due to excessive sugar consumption, as well as a chronic sore throat, swelling and pain in her jaw. The lead-based makeup she used weakened her skin, irritated tissues, and increased the risk of infection. A small, untreated infection, whether dental, sinus, or throat, could easily escalate. Sepsis, often called blood poisoning, is the body's extreme reaction to an infection. Instead of fighting the infection normally, the body's response spirals out of control and can become extremely life-threatening. Historians and medical researchers often speculate that Elizabeth's chronic dental infections, such as abscesses or severe gum disease, allowed bacteria to enter her bloodstream. Sepsis itself doesn't usually cause one single pain. It's a systemic condition, so the discomfort comes from multiple sources at once. Chroniclers say Elizabeth became so weak she could barely stand or speak. This matches the fatigue seen in sepsis. The body burns immense energy fighting the infection. Reports mention she had fever and chills. She reportedly had a rapid heartbeat and struggled to breathe. She looked physically drained. Multiple witnesses said she became silent, withdrawn, and stared into the distance, refusing to speak for long periods. This aligns with delirium, one of the most common signs of sepsis in older adults. Pain in her throat and jaw suggests the infection likely began there. The pain would have been constant, spreading, and eventually severe. Accounts say she gradually sank, stopped speaking, became unresponsive, and drifted in and out of consciousness. Her death would have been slow and very painful, sliding into unconsciousness rather than a sudden, dramatic collapse. Doctors in Elizabeth's era didn't understand germs, bacteria, or infection. They believed all illness came from an imbalance of the four humors: blood, phlegm, yellow bile, and black bile. To cure someone, they tried to restore balance. Physicians thought the blood itself was corrupted. They would draw blood or use leeches to let out the bad blood. This was supposed to remove poison and rebalance the body. In reality, it weakened patients further. They also induced vomiting or diarrhea by giving patients toxic mixtures to flush toxins from the body. Of course, these treatments caused dehydration and made things worse. Accounts suggest that Elizabeth refused treatment. She was politically astute and often wary of her advisors, including her physicians. We can't know for sure whether Elizabeth really suffered from sepsis. However, this might have been the real cause of the end of the Tudor dynasty. But what happened to Elizabeth's body after she died was also far from peaceful. Click to learn more.